At an age when many women are becoming grandmothers, a 56-year-old woman from New York decided to tackle motherhood for the first time. Wednesday, Alita St. James gave birth to twins. That's 2 babies. She says the experience has been wonderful, but just how risky is it for a woman her age to become pregnant? Tom Ziska joins us now with more on that. Tom?
Jen, thank you. Dr. Timothy Hickman is a reproductive endocrinologist from Herman Memorial City Hospital, and he joins us this morning to talk a little bit about this issue. Thanks for coming in. We appreciate it.
My pleasure.
Let's start with the danger versus age issue. How dangerous is it for a 56-year-old woman to be giving birth to children?
Well, clearly pregnancy is a problem with increasing age. I mean, it takes a big toll on the body. So we have an increased risk of things like high blood pressure, there's an increased risk of C-section, increased risk of problems with the lungs and kidneys and so forth. So there's no question it's a health risk.
A lot of people who hear this story and see this woman, and obviously, you know, that she had a successful birth, a tremendous success, that's grand. But they ask, why should a woman this old be choosing to have children? And what part of that goes into the ethical decision to help a woman in this particular situation?
Yeah. Well, that's a great question. And clearly her age is the controversial part. The fantastic thing is that the medicine has evolved to the point where we're able to help women have children. And of course she used donor eggs,
yes.
Eggs donated from a younger woman, and that's really the limiting process. So if one chooses a donor that's young, that changes things. Now, as far as how old one should be, that's kind of an ethical debate, in that our subspecialty has looked at that question and felt that really the appropriate age to stop is at the age of natural menopause. So most in the country here would stop at age 50, 51, somewhere in that range.
And that's an ethical choice that a physician or a practice as a group would make.
Yeah, there's no mandate on a limit of any type by the government or so forth, but most physicians feel that that's about the appropriate time to stop.
In that some physicians, obviously, as in this case, will make the decision to help older women. Do we get ourselves into a situation, you think, where some physicians are going to say, well, you know what, I think we can help push the 60-year-old woman, the 62-year-old, and on and on? Do we get ourselves into that conundrum?
Well, we could. Medically, it's possible. I mean, theoretically, we could take an 80-year-old woman, and she might have a heart attack during labor or break her hip during the process, but it's possible. So the question is, you know, how far should this go? And we don't have strict answers. We do have guidelines, and most people would say the age of menopause is pretty much where one should consider stopping.
Well, I know it's a development that I know your profession will certainly be discussing. Dr. Timothy Hickman, thanks for coming in. We appreciate it.
My pleasure.
We appreciate your wisdom. Jose and Jan, back to you.